The California Black Health Network is celebrating its 40th anniversary. The organization is dedicated to advancing health equity for the African American community. Joining us today is Rhonda Smith. Rhonda, good morning. Thanks so much for being here.
Thank you for having me today.
First of all, explain for people who may not understand why health equity is so important for African Americans.
Well, health equity really is the fair and just opportunity for everyone to achieve their highest level of health. And unfortunately for Black and brown communities, there are barriers that get in the way of that happening. And so much so that here in California, the life expectancy of Black Californians is about 5.5 years less than the state average. So we need to do our part to close that gap so that everybody lives a long, healthy, vibrant life.
You guys are celebrating 40 years, which is amazing.
Yes.
This week is pretty special. So break down for me all the different things that are happening this week. There's a lot going on.
Yeah, so this week is Black Health Equity Advocacy Week, and thanks to the California Legislative Black Caucus and particularly Dr. Akilah Weber for supporting the resolution. So this week we have our first ever Health Equity Advocacy Training Program participants coming to Sacramento to put all their learning into action, meet with their state representatives, and advocate for issues that are impacting their community to drive change and help improve the health and well-being of individuals in their communities. We have our 40th anniversary event, which you're a part of, on Thursday night at 6 p.m. at Mix. We also will be receiving officially the resolution on the floor of the Assembly on Thursday morning.
Okay.
And yeah, so we're really trying to uplift and elevate the importance of focusing on closing that gap in life expectancy and advancing health equity for all Black Californians.
Talk more about the event on Thursday so people can still attend, right?
Yes, people can register. If you go to the website, that's CA as in California abbreviated, CA blackhealthnetwork.org, and go to events. You'll see in the drop-down menu the 40th anniversary, and you can register there. There's still opportunities to sponsor or make a donation. Also, on Thursday is the big day of giving, so we're 40 for 40 this year. We're trying to raise $40,000 for the 40th anniversary, so if you can't come to the event, you can still help support the work that we're doing.
Absolutely. That's one day of many that people can support if they choose to.
Yes.
Talk to me about what you've seen over the years as it relates to health equity and Black and brown communities. Has it gotten better? Has it gotten worse?
Unfortunately, no. Even though there are more people who have health insurance, we're still seeing poor outcomes when it comes to maternal health, infant mortality, diabetes, cancer. So there's definitely structural and systemic issues, like I mentioned in the beginning, barriers that get in the way of closing that gap.
Yeah.
So there are communities that have social determinants of health that don't favor creating a healthy situation, and so those are some factors that impede us making progress and closing that gap.
What does it take to change it? I know there's not one simple solution, but what would you say?
No, it takes a village, right? So it takes policymakers for sure. I think programs come and go, but policies are more sustainable and longer lasting. It takes providers really providing more equitable care and more culturally competent care. It takes the community and partners working together to support the health and well-being and cultivating that in communities. It takes patients, right, being more empowered to take their ownership of their health and well-being and know how to engage in a conversation with their healthcare provider and navigate through the healthcare system. So it takes a host of participants to really close the gap. And like I said, programs come and go, but we know that policies will really make the difference in addressing those issues that exist at the system level.
Rhonda, we thank you for being here. We want to show that full screen one more time for our viewers. That event happening on Thursday at Mix. I'm honored to be the MC, so I will be there. Rhonda was gracious enough to ask that I be there, so I will be there. It's from 6 to 8 on Thursday. Mike, back over to you.